The next disease is one I have brought up before. This is cholera, and this has been a well-known disease for hundreds of years. It is a huge problem around the world, mostly whenever people can't get clean drinking water. Because again, famously, this bacterium has a very high infective dose, and that's because most of the cells die in the stomach. And so in order to get cholera, you have to ingest so many that some of them can get lucky and pass the stomach without dying. And that's very uncommon. That's why the infective dose is like 10 million cells, something like that. And it varies a lot from strain to strain because some are more or less tolerant to these conditions in the stomach. So after a short incubation time, most people will shed the bacteria because it will grow in their guts. And this can happen if the bacteria don't have certain virulence factors, like the toxins that affect the cells, or for whatever reason they don't express them, they don't release the toxin, or if there's a strong immune response already. But in about a quarter of cases, there is a mild diarrheal illness. And then in a smaller fraction of cases, there is just severe, almost uncontrollable diarrhea, and that leads to rapid dehydration, and a person can die in a few days. Less than 2 days is what it would take to die of dehydration if you have severe cholera. The other thing is, this could also depend on the dose you get. So if people are dealing with highly contaminated water, they are more likely to get the severe form. And so all of the signs and symptoms come from what you would get from extended diarrhea, where the body is excreting water into the large intestine, into the small intestinal lumen, and ultimately no feces can form in the large intestine. So what's coming out is essentially dilute small intestinal, normal small intestinal contents, but very diluted. So that's why they call it rice water diarrhea, because it looks like just barely cloudy water. So these are the things. These are the things I've mentioned about virulence factors. This I haven't brought up before. Vibrios are not super durable cells. They don't resist things like boiling. So basic sanitation, basic water treatment can prevent cholera. It's really when people don't have access to any water treatment that cholera is going to spread quickly. So the famous rice water diarrhea removes water from the body. It is the body's water quickly being lost. And so for severe cholera, the most effective treatment is to measure the amount of water lost and replace those fluids in an electrolyte salt-sugar combination. And one of the slides has a common recipe, and it's like salt and sugar and a few other things that people are likely to be able to get. Oral rehydration therapy is what this is called, and you'll see it's common for a lot of the diseases we're about to talk about, and for cholera it is the life-saving treatment. There's no need to treat with antibiotics. There's no need to treat with antibiotics. Usually just replacing the fluids and electrolytes will keep a person alive long enough for their own immune system to respond and get rid of the bacteria. Okay, let's move on. We will come back to diseases like cholera. We're kind of grouping them by pathogen in some cases. So here we're looking at Clostridioides difficile, or Clostridium difficile, or C. diff. This is pretty well known by now. It's hard to get numbers for C. diff infection, so I can't really give you, I can't come up with a great number. This is the best I could find for how many infections there are per year in the US. So take those numbers with a grain of salt. The point is that it does happen all over the US, And about half of the cases are healthcare associated, so people will get them while in an inpatient setting. And what this leads to in most people is diarrhea, fever, in some cases dysentery, so kind of severe diarrhea, because this pathogen is damaging the epithelium, and in severe cases, really killing the epithelium and causing severe dysfunction of the large intestine. C. diff is kind of unusual in that it usually happens as a result of antibiotic treatment. So originally it was first seen only when patients would have been given broad-spectrum antibiotics that affected the lumen of the large intestine. So what we used to see, so 20 years ago, the only time we would see this would be if endospores of this bacterium had gone through the gut and made it to the large intestine, and then the patient was treated with broad-spectrum antibiotics that didn't inactivate these endospores, that would allow C. diff to kind of take over the gut. Once there is no competition or reduced competition, they could start growing and releasing exotoxins, and the exotoxins are what causes the disease. So different C. diff strains will have different toxins. If you're infected with a C. diff strain that doesn't have either of those toxins, you don't get any disease. So that's a thing. So what you're seeing here is a thoroughly damaged colon, and these yellow spots are dead lesions. They're dead epithelial cells, and that's a pseudomembrane. They're forming a barrier that's preventing the healed cells that are underneath them from absorbing water and electrolytes. So this pseudomembrane disrupts the function of the large intestine, and yeah, that's bad news. So again, this was caused by antibiotics, and clindamycin was originally the major cause, but now there are other extended spectrum drugs, lots of other things like the cephalosporins, and they cause it more often. And we think transmission is fecal-oral, which makes perfect sense because if it's growing the large intestine, huge amounts of it are coming out through with the feces. And so it's, well, especially during diarrheal episodes, it's very difficult to prevent any bacteria from escaping. And so because of that, a lot of people are probably exposed to C. diff. But it looks like dysbiosis is necessary for them to grow. So it looks like a thorough disruption of the gut bacterial populations has to happen first. And if that hasn't happened, C. diff just cannot compete. And so about 10 years ago, there was a big push to start really cleaning clinics and so hospital rooms, bedrooms, operating rooms, any room that could be contaminated with endospores. They started using like ultraviolet robots and things like that that could just do deep cleaning overnight. And to some extent, this has decreased the healthcare associated C. diff incidence. So it's not quite as bad as it was, but now there is more community-acquired C. diff. So now people are getting it outside of the hospitals in ways we don't know. So to prevent it, one of the best ways to prevent it is to use antibiotics responsibly, and we can treat C. diff with several different antibiotics. Really, any antibiotic that would work against the Clostridium has to accumulate in the colon to work. And so we can't use oral antibiotics that are absorbed in the small intestine into the bloodstream because they would not accumulate in the colon. And so that's a big driver of which antibiotics you use. And so Fidexomycin and Vancomycin are interesting. Vancomycin just doesn't get absorbed, so oral vancomycin will go into the gut. Fidexomycin, I think, is the same way, and metronidazole is strange because it is absorbed by the gut, but for whatever reason, it accumulates near epithelia. So it achieves fairly high concentrations in the capillaries just under the epithelia. So it actually would be excreted into the lumen of the gut in small amounts. So we can treat this with these antibiotics, but in some cases there are recurring infections. Some people will get repeated C. diff that they can't keep away. They can't cure it. And what this typically means to us is that there is some kind of repeated dysbiosis. There's some reason why the normal gut community isn't out competing the C. diff. And it may be that these days now there are C. diff strains that are more competitive. I don't know what's going on with that. But I know that the recurring C. diff infections are hard to treat. And so that has been what's really driven the rise in fecal microbiota transplants. And the reason doctors would take these seriously as a treatment option is that they have no other option. If C. diff is recurring and doing more and more damage to the gut each time, they will do whatever they can. And a fecal transplant essentially, in a huge way, resets the gut microbiota with someone else's gut microbiota. So you take a huge quantity of bacteria from someone else's gut, put them in your gut. Your immune system responds to it in the way it normally does and kind of does a little bit of selection for and against some of those strains. Your own unique chemistry does a little bit of that. Your diet drives a little of that. But ultimately, you end up with different species, a lot of different species in the gut. And that is, in a lot of cases, our best hope for rebuilding a gut bacterial community that can defend against C. diff. So that was a lot about C. diff. Listeria Monocytogenes is a kind of a wild one. It's not very common, and it's mysterious. So, for example, look at this range of incubation times, between 3 and 70 days. Also, it's a psychotroph, and that means it grows preferentially at low temperatures, such as what finds in a refrigerator. Normally, infections are controlled by cell-mediated immunity, and anyone with weakened cell-mediated immunity is at risk of this. And so newborns and fetuses and pregnant women in particular, but also anyone who's immunocompromised or for whatever reason. And so what we would see is fever and malaise, and that's what we would expect from an invasive systemic infection, but also some liver damage that attacks the joints. It can spread to other tissues. It can cause disease in the brain, and it can cause sepsis, and so those are obviously severe. So this disease is not common, but it is so dangerous that it is one of the major causes of death from foodborne outbreaks. So, yeah, a lot of the people who are going to get the disease are what we consider the high-risk group. But we don't know the reservoir or the vector. We don't usually know how people get it. It can grow in our guts, so it could be fecal oral, but we also find it on vegetables. We find it in refrigerators. We find it in soil. We just don't know how people get exposed to it. And it may be we were all exposed to it all the time, and it just causes disease when it can. We just don't know. One thing Listeria has is a wild and kind of amazing way of moving from cell to cell to evade the immune system without flagella. So it has a way of swimming in cytoplasm without flagella. And so in the curiosity slides at the end, I give details in a movie link. The last one I'm going to talk about in this video is Helicobacter pylori. And this is the bacterium that causes peptic ulcers. So I grew up with a generation of people who were told that stress causes ulcers. But a microbiologist noticed a correlation between these ulcers and the presence of this weird bacteria in the stomach. So these bacteria can grow in the stomach, and a lot of people have them in their stomachs. Something like 50% of the world has these. And so people who have these have a higher risk of getting ulcers and a higher risk of certain cancers than non-infected people. And so famously, the researcher who noticed this was quite convinced that these bacteria were the cause of the ulcers, and no one would take him seriously. So he famously drank a culture of these bacteria with other scientists present, got an ulcer, and then cured his ulcer using antibiotics. So he showed that by taking antibiotics, he killed the bacteria, and that led to resolution of the ulcer. So that story is in the curiosity slides. Yeah, it's so common, we just don't know how it spreads. We don't know why we typically in the US don't have it. It's not as common here. But a few things about it. It grows in the mucus and very close to the epithelium in the stomach. Some of its virulence factors include urease, which creates ammonia, and that can neutralize stomach acid in its local environment. Also, it releases a toxin that kills the cells that would be producing mucus. And so parts of the epithelium become exposed directly to the stomach acid, and that's what leads to peptic ulcers. So if we can remove these bacteria from the stomach, they won't cause this damage. Okay, that's enough for one video. I'll see you at the next one.